Hello and welcome to today's Sports and Exercise Medical Science Bachelor of Sciences taster session. Thank you very much for joining us. My name is Ziyan Man and I am a current Sports and Exercise Medical Sciences student here at UCL and your chair for this afternoon. We are hoping this taster session will address these course-specific questions you may have and will help you gain an insight into what it is really like to study on our Sports and Exercise Medical Sciences undergraduate program. So this afternoon, our speaker, Dr. Tom Gurney, will introduce you to some of the great science and medicine that you would learn as a student of Sports and Exercise Medical Sciences, Bachelor of Sciences here at UCL. Dr. Tom Gurney will also provide a summary of the Sports and Exercise Medical Sciences program, and there will be a Q&A session for the second part of this event. This session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. Now to introduce our speaker, we have Dr. Tom Gurney. Dr. Gurney is a lecturer at the Institute of Sports, Exercise, and Health at UCL and is the Year 1 academic lead for Sports and Exercise Medical Sciences. He is also module lead for exercise physiology and sports and exercise performance optimization across BSc, MSc, and intercalated BSc cohorts. His research interests are supplementation for health and exercise performance. Dr. Gurney also used to work at Fulham Football Club as a performance analyst within the academy, and then first team where he was involved during their 2019 and 2020 promotion campaign to the Premier League. He has been teaching in higher education for over 6 years and is regularly engaged with widening access activities within medical sciences. Over to you, Dr. Gurney. Thank you.
Thank you very much. All right, so I'm just going to share my screen. Okay, cool. Thank you very much for the introduction. So, my name is Dr. Tom Gurney. I am going to be introducing you all into the world of cardiopulmonary exercise testing today, and which is one of the topics which we cover across your undergraduate degree in year 1 and in year 3. So, just a brief summary of today's outline. The first part we're going to be giving you into some insights into CPET testing within sport medicine. And then I'll be talking about what it's actually like to study sport and exercise medical sciences at UCL, covering some of the modules that you'll cover across year 1 and year 3. And then talk about some of the possible careers within sport and exercise medical sciences. And then more than happy to take your questions at the end as well. So what is CPET testing then? Well, for those of you who have got some eagle eyes, you already understand that it stands for cardiopulmonary exercise testing. Some of you may already know of the term VO2 max, and these terms are sometimes used interchangeably, but often what we really do is we mean the same thing when we talk about this. Simply put, the CPET will measure our body's response during incremental exercise, and we're primarily interested in the heart and the lungs when we complete a CPET test. This is a test that you'll become very competent in doing when you study sport and exercise medical sciences at UCL. We cover it in year 1, and you'll be using some of the applications in year 2, and then also delve into some of the clinical applications in year 3 as well. And it was the late, great Carl Wasserman who was a pioneer in exercise physiology and was one of the first to investigate how the heart and the lungs function during exercise. And he also was one of the founders of the 9-panel plot, which I'll talk about in a little bit later. But essentially, he also came up with this beautiful figure, which is looking at the relationship between the heart, the lungs, and the muscle, and how we respond to exercise when we breathe in oxygen and breathe out CO2. And you can see during these cogs that as we inhale oxygen, comes into our lungs, It then goes into our heart and consequently into our bloods. And then we start to use oxygen at the mitochondria, where we then start to produce CO2. It then comes back out to our bloods, and then we eventually expire it in the form of CO2, so carbon dioxide. A 9-panel plot and the CPET testing is an excellent and really informative, cost-effective test, which allows us to investigate a broad spectrum of disorders with patients that may have symptoms or may not necessarily have any symptoms when they start to exercise. And this is a really exciting test in which you can perform or learn to perform because it's so cost effective and informative. It allows us to give us so many different variables and understandings and investigations into different areas of an exercise physiology. So what basic variables does a CPET test measure then? Well, on your left-hand side graph here, you can see that we've got a patient hooked up to lots and lots of leads, and then we've also got the clinician, otherwise also known as an exercise physiologist, for example. We would typically be looking for is our oxygen uptake and carbon dioxide production. We'd also be interested in looking at our minute ventilation, so how much air we are breathing in per minute, and then also our heart rate, our oxygen saturation, so how saturated our hemoglobin is with oxygen, and also something called our respiratory exchange ratio, which is the ratio between oxygen consumption and CO2 production. And you can see here in this figure on the left-hand side, the patient is hooked up to a mask, whereby as they start to exercise, we are measuring what is being breathed in and being breathed out. And within this mask here, there is a very delicate turbine and also a gas analyzer. The patient will also be hooked up to an ECG probe as well. And on the finger, they'll have the oxygen saturation monitor as well. Some of the equipment that they might use when completing a CPET test is also a blood pressure monitor. There are various cutoff points in which we will use to ensure that the patient is exercising safely. They will also use the gas analyzer as well, which you can see here is number 6. And this is essentially measuring all of the inspired and expired air coming from the patient. The typical ergometer that we will use is a bike or also a treadmill, but sometimes we might use an arm crank, and I've got a nice little neat video for you guys to have a look at a little bit later on. But it wasn't always as simple as using these nice, fancy metabolic carts, which you just saw on the figure in previous slides. Historically, in order to measure an individual's inspired and expired gases, we would have to measure this in a Douglas bag. So you can see these figures from 1928, where these individuals out on the field and they've got these two-way valves that what they're breathing in and out through, and they're collecting all of the expired air through these Douglas bags. And this was quite some cool ways in which we could have a look at the demands of exercise in the field. So you can see we've got cross-country skiers here, we've got a runner, and we've also got some boxers. These are some of the more early works and where we're trying to understand what the metabolic demand is for exercise. But in today's world, what we would typically do from a clinical perspective is get someone into the lab and hook them up to lots of fancy bits of equipment. So it's a little bit easier for the exercise physiologist now. So what happens during a CPET test then? Well, usually the patient will have to do some sort of incremental exercise. That's either on a bike or a treadmill. And in order to investigate the lungs and the heart, we need to stress them. And so what we do is we increase the workload very slowly, usually every minute, in either a continuous fashion, so slowly, or in a step fashion. And in this step fashion here, is what's happening is that we're adding the watts every minute until the patient can no longer cycle or run. And so it's really a difficult test. What I tend to try and explain to patients is that it's like cycling or running uphill, and you've just got to keep going and going and going until you can no longer continue. And that will give us a really good indication then of how well your heart and lungs are functioning during exercise. There are 4 key phases of a CPET test. The first is the rest phase, and usually what will happen is the exercise physiologist will be measuring your resting data to ensure that there's no abnormalities in that. We will then begin what's known as the warm-up phase, or sometimes the unloaded cycling phase. And it's called the unloaded cycling phase because sometimes in clinical populations, warming up at 0 watts is sometimes the best method for them because otherwise they may fatigue very, very quickly. The main phase is then where the patient will then be exercising incrementally, and we usually try and ask the patient or get the patient to perform for a minimum of 8 minutes, and usually the best practice is between 8 and 12 minutes. The figure you can see here also has predicted value boxes. So in the blue and the red, we'll have predicted values in which the patient must be reaching in order for us to determine whether or not the patient is healthy and has a healthy response to exercise. The machine uses various algorithms to work this out. Usually it's based on the gender, the BMI, the age, and the ethnicity of the patient. It's also really important as an exercise physiologist, and this will be something that you'll learn in year one and also in year three when we visit this, is that it's really important to set that intensity at the correct starting wattage. So, for example, you would have a very different starting intensity or wattage for a clinical population in comparison to an elite athlete. And it's also important to make sure that we set the increments correctly as well. So if we don't do this, then we may fatigue the patient very, very early. So they may only be able to complete 1 or 2 minutes. And that is not enough time for us to be able to get a really good amount of data to see how their heart and lungs function during a CPET test and incremental exercise. It's also really important to select the right modality. So certainly from an elite athlete perspective, there's no point putting a runner onto a bike and vice versa. And usually our elite athletes will be paying quite a bit of money to come and do a CPET test, and they won't be too happy if you put them on a modality or exercising modality that they're not particularly comfortable with or that is applicable to their sport. For the general and clinical populations, when you do some clinical investigations, it's also really important to think about what the safest modality is for them. Usually, this will be a bike because it means that they are less prone to falling off, and it means that they can stop quite easily and quite quickly when they need to. For elderly and obese populations, if you were to put them on the treadmill, this might be too impactful for their bodies, and also they may be particularly susceptible to falling as well. So usually from a clinical aspect, we will try and put our patients onto a bike and start the intensity nice and low and slow. I've previously discussed the two main modalities for doing a CPET test from a clinical perspective, but there are also lots of other ways in which we can do VO2 max testing, so more from a performance perspective. And in this video here, you can see an athlete on a kayak and in a flume. So you can see that this individual has got the VO2 max mask on here, gathering all of the inspired and expired gases, and you can and in their backpack will have the metabolic analyzer, and then this flume here will be increasing the intensity, going up as fast as he can go. We also have swimmers doing these types of tests as well. So here you can see the Russian Federation doing a swim VO2 max test. See if I can move this forward. It's not letting me. Oh. Okay, it's not letting me skip forward, but what essentially happens in that test here is that the swimmer is in a swimming flume, and they're also doing their VO2 max test as they start to swim along the flume. And these athletes as well will be doing lots of investigations in terms of the lactate testing, the heart rate tests as well, alongside the CPET test as well. We also have examples of patients or participants doing arm cranking as well. So in this video here is a video from my undergraduate studies, whereby we were investigating CPET tests during arm crank cycling. So this can be really appealing to not just able-bodied athletes, but paraplegic athletes as well, who may not be able to use their legs in the typical fashions of using a treadmill or a bike for a CPET test. So I guess that brings us on to the question of why do we perform a CPET test then? Well, there are lots of reasons why we might perform a CPET test. Critically, consultants might use a CPET test as a pre-operative risk assessment, and they have cut-off values in which they will employ to ensure the safety of their patient. And these cutoff values will have been determined as a way of understanding how well a patient will respond to major surgery or maybe particular treatments as well. But the two main areas in which we tend to focus at UCL is investigating symptoms of exercise intolerance, and then also helping us use CPET testing for training zones and thresholds, and preparing our athletes maybe for particular upcoming events. So in terms of investigating symptoms of exercise intolerance, what would typically happen is you'd have a patient who may be struggling when they are doing any form of exercise. This could be simply walking up the stairs and we're getting really out of breath, or it could be actually when they may be doing some running or cycling or any form of activity as well. And as I'm sure you are aware, we are investigating obviously the heart and lungs predominantly, but we are also investigating how the muscles respond and a little bit of how the brain is working as well in terms of motivation. So what would happen is when they do a CPET test, we would investigate whether there are any abnormalities and where these might lie. And we would typically go and investigate the heart and the lungs using the 9-panel plot. As clinicians, we can use very basic interpretation strategies just to begin with. And this is, for the purpose of today, we'll be talking about the basic and simple interpretation strategies. But when you come and study with us at UCL, we go into a lot more detail into this area and spend several weeks going into the 9-panel plots and understanding how you can interpret some of the data. But as a general rule of thumb, if the VO2 max is less than 80% of the predicted, this means that there is a reduced aerobic capacity. And therefore, you, as the student, will have to try and work out and understand where these clinical impairments may be. Or alternatively, it might just be because your patient is deconditioned, so very sedentary, or doesn't do much exercise, and so didn't have much motivation for completing the test. What is good to know, though, is that usually if a patient can reach above 80% of their predicted, we can be pretty confident that there's no serious clinical problems with their heart and their lungs in terms of exercising. This is one of the key panels which I like to talk about when I do some of the CPET testing with the students at UCL, and this is panel 3. On your x-axis, so down the bottom, you've got time. And then on your y-axis, you've got your oxygen consumption and your CO2 production as well. And you can see here, the blue line represents our oxygen consumption, and our red line represents our CO2 production. And in the resting phase, we'd expect this to be quite low and a plateau. Okay, so it's not a lot is really happening here. We've got a little bit of variation. But as we start to exercise, you can see that we have a linear increase in our oxygen consumption and CO2 production at the same rate almost as our work rate. So in terms of when we start to increase our watts, this is what a normal response would look like, and this will allow you to understand whether or not someone is reaching their predicted work rate and their predicted oxygen consumption as well. And we can unpick this into a lot more detail when you decide to come and study with us at UCL. Just to briefly touch on some of the panels in terms of investigating where some clinical impairments might be, if we suspect the lungs, we would typically go to panels 1, 4, and 7. And you can see here that these will allow us to investigate whether there's any lung impairments. Panels 2, 3, 4, and 5 will allow us to see if there's any cardiovascular problems. And then panels 9 will allow us to see if there's any gas exchange issues. So gas exchange is talking about how well our body does in moving oxygen from our lungs into our blood and vice versa. So CO2 coming out as well. And it also allows us to look at our thresholds. So panels 5, 6, 8, and 9. And as a student at UCL, you'll spend a lot of time going through each of these panels, understanding the really nitty-gritty physiology behind them and how and why there may be differences in a healthy population in comparison to a clinical population. We also talk about the respiratory exchange ratio, which is that ratio between oxygen and CO2. And what happens is at rest when you're currently watching this video back, we are predominantly burning fat as our energy source. And as we start to exercise and start to become into this much higher intensity, these fuel states switch and we start to predominantly burn glycogen as our main fuel source. And this is a really good indicator as well as an exercise physiologist to understanding how hard someone is working. So as a cutoff value, we usually say that anything above 1.15 of the ratio, we're quite happy that they'll be working at their maximum. So you can see here that this patient here has definitely gone above 1.15 during their VO2 max and CPET test. But it also helps us identify training zones. And you'll do a lot more detail into this into your year 2 modules with Joe when he talks about some of the strength and conditioning side of things and how we might be able to use CPET testing to identify training zones. On your x-axis, we've got our wattage, so how hard someone is cycling. And then on our y-axis, we've got our liters per minute. So you can see here that there's 2 inflection points, which is also known as our ventilatory thresholds. So ventilatory threshold 1 and ventilatory threshold 2. And at the top here, we've got our VO2 max. So we can be quite confident that our athlete reached, let's say 450 watts at their VO2 max. Once we know what their max wattage is, and the same for heart rate as well, we can then try and work out what might be an appropriate training zone for our athlete within the aerobic domains, and then also within the anaerobic domains at the top here. Okay, so predominantly here, our athlete will be working aerobically, and then as they start to progress towards their VO2 max, they're starting to borrow their time essentially, and they're exercising anaerobically. Once we know what their heart rate max is as well, we can also do exactly the same for their heart rate zones, and then we can set the appropriate training zones for their heart rate as well. And this can really help athletes with their training load, and also to ensure that they're doing the correct intensity for the correct workload as well. As clinicians, we can also test or understand what the whether or not our CPET test has been reliable and valid. And there's key attainment criteria which we will use to do this. And you can see them listed here, which is also, I must say, heavily disputed in the literature. But what we tend to do is we try and see whether or not there's a plateau in oxygen consumption. Doesn't always happen. It's more common in athletes. We'll use our estimated heart rate max, our RAR being above 1.15. Sometimes, if you're lucky, you'll do blood lactate as well, and our RP, which is our respiratory exchange, which is our how hard we're working, so how hard we feel like we're working. So our rating of perceived exertion. So failure to reach some of this criteria might simply be that the athlete or the patient is not very motivated, or they might be deconditioned, so very sedentary, or it might be a clinical impairment. And that's what you'll learn about when you come and study with us at UCL, is trying to understand and identify what 3 questions this might be the answer to for if they didn't reach their key attainment criteria. So in summary then, we perform a CPET test for multiple reasons in multiple populations. And it's a really excellent tool to use because it's so cost effective, but also so informative. And what we do is we stress our cardiac and respiratory systems and observe their response as we start to increase the workload during a CPET test. Importantly, if a patient has reached their predicted max, so about anything above 80%, we're usually pretty confident that there isn't any abnormalities clinically. But if it is below 80%, then that's where we begin to start our investigations into whether it might be the heart or lungs which might be causing problems for our patient. What's something is important to note at the bottom here is that CPET data doesn't always provide us with a definite answer. So it usually helps us give us an indication and help further clinicians understand clinical impairments with our patients. So that was a whistle-stop tour of the world of CPET testing, and we will go into a lot more detail when you decide to study with us at UCL, and go into a lot more of the physiology behind CPET testing as well. I'm now going to talk about what it's like to study sport and exercise medical sciences at UCL. And we are very unique in our program. And the reason that because is that we combine medical sciences with sport. So by the end of your program, you'll be studying medical sciences in terms of how the body works in health and disease. You'll also look at how to manage diseases through physical activity. We also do a lot of modules on sport injuries, how to optimize sport performance as well, whether that's elite or the general population. And we're also increasing our neuroscience modules as well here at UCL. So it's a really exciting time to join us. And this is because we are a 2012 Olympic legacy. So all of the subjects that you'll be taught in will be taught by world-renowned experts from various departments within UCL. But we also take massive pride in our partnership with the Institute of Sport and Exercise and Health. And we have lots of exciting opportunities at our building, whether that is networking with current clinicians or opportunities to work in elite sports and maybe in the general public too. And you'll benefit from a lot of world-class teaching from various individuals and experts from UCL, and also increasingly so from the brain sciences department as well, from the neuroscience perspective. I think it's important to define what sport and exercise medical sciences is and what makes us so unique and different from other programs, such as if you were to just go and study sports science. We are, of course, the integration of medical sciences with sport and exercise science, as well as scientific research. And this is something that UCL prides itself in terms of how we teach and how we deliver the current up-to-date trends in sport and exercise medical sciences is teaching through research. So what's the difference between sport and exercise medical sciences then and maybe a typical sports science degree or physiotherapy degree? Well, in a sport and exercise science degree, so just sports science, you'll do a lot of focus on performance. You'll work with healthy populations. You won't typically do a lot of clinical work, and you won't tend to do much work in injuries or rehabilitation. From a physiotherapy perspective, this will be a lot more of a clinical background. You'll do a lot of work into musculoskeletal systems, how to assess injuries, and maybe how to do some rehab. And where we sit is right in the middle of all of this. So we have a strong scientific basis of athletes, clinical populations in health and disease. And we also go into how to prevent disease as well, rehab injuries, strength and conditioning, almost sort of the best of both worlds in the sport and exercise medical sciences. Here you can see what some of the neuroscience research is currently happening at UCL. You can see here we've got some brain imaging happening whilst individuals or patients are exercising and doing some cognitive tests. We've also got some examples here of our students doing some CPET testing in healthy populations. And a lot of our research projects will be linked to CPET testing or some form of physical activity testing. In these photos here, you can see that we're also looking at force assessments. So looking at how much force our muscles are generating. The figure on the right-hand side is the biodex. And this biodex is comparing, allows us to compare both our left and right muscles to see whether there's any imbalances, which may mean that we are more prone to injury. The photo on the left-hand side here is quite funny in so much that if you notice up the top here, we've had to take some of the ceiling out because our patient was so tall that when he was jumping, he was banging his head. So we had to take some of the ceiling out when doing some of the force assessments with him in the lab. As I've previously said, you'll learn how to assess injuries. On the left-hand side here, we've got our expert physiotherapist doing some assessments into injuries. On the right is some medical imaging. So you have a medical imaging module with us at UCL, where you'll look at how to use medical imaging to inform your practice as a physiotherapist as well. In year two, you'll learn how to design strength and conditioning program in healthy populations. And then in year three, you'll also learn how to prescribe exercise to clinical populations as well. And this is all taught by experts across UCL and across various other departments and external experts as well. So I'm going to briefly talk about some of the program structure now. And you'll notice that across years 1, 2, and 3, there's a really nice breadth of modules in which you can get engaged with as a UCL student. So just for the color coding, the modules in blue are modules taught predominantly by the Sport and Exercise Medical Sciences team here at the ICH. The modules in orange are the predominant medical modules where you'll learn about the foundations of health and disease, how the kidneys and function, the hormones, fluid balance, how the gut, liver, and drug metabolism works, which then brings you on quite nicely into year two, which is looking at the molecular basis of disease, the nervous system. And these are all really exciting modules in which you will not typically learn if you went and just did sports science. The modules in purple are research. So understanding how to conduct research is a really important skill that you'll develop as a UCL student. And that builds you up quite nicely into year three research project where we will be, or you will be doing your research with staff at UCL. So in year one, you'll be doing quite a lot of your time will be looking at uh, medicine and how the body responds in medical areas. And then you'll do some sport and exercise modules too. And then year two, we slowly build on from that. So you'll be doing slightly less medical modules here. And then you also get the choice, the option to have some optional modules to pick from throughout the years as well. So in year two and year three, you'll get to select some modules which you might have a particular interest in as well. I should say that these ones in grey represent that, but there's also a lot of staff from the Sport and Exercise Medical Sciences will teach on these modules as well. That brings you on quite nicely to some of the career options that you'll have once you've finished taking part in this degree. The good news is, by completing this degree, you'll have a really excellent understanding into a massive range of disciplines within sport and exercise medical sciences. And this will allow you to slowly fine-tune your expertise as you progress throughout the years. Some of our students will go into elite sport. They'll work with professional sporting teams or athletes. Some of our students will become exercise physiologists and go and do some further studying into those clinical exercise physiology degree pathways. A lot of our students will go on and go into public health. They may go on and study further into postgraduate degrees. Some of our students will also do graduate medicine as well. And so there's really so many options in which you can do after studying this degree, which I think is one of the most exciting parts because it means that it doesn't narrow your options as you begin to study. That brings me, I think, or moves us in quite nicely to the question and answer section. So I'll stop sharing my screen. I'll be happy to have a conversation with you all. So please feel free to put any questions into the chat. or unmute your microphone, and I'll be happy to answer any questions.
So I could talk about how I find the course so far. So year one is, I mean, as Dr. Gurney has said, year one is a lot more like the medical side focus, I feel like, especially in term one where you spend a lot of time, well, studying at a hospital. So it is and then and then term two of year one, I got like a slight of a refresher and stuff. When you finally get to study at the Institute of Sports Exercise, uh, ISEH, which is very fun. And then year two, which I'm in year two student right now, and it's kind of the same thing. Um, okay, so we had a question. Thank you so much for the question. It was a really interesting. Could you please go back to the slide with your contact? Oh, and you answered it. Okay. Um,
So, how have you found sort of your year one modules then?
the year one modules they were okay, but I can definitely feel that I'm enjoying my year two modules a lot more, at least like so far. Yeah, but it's still pretty fun. Yeah.
Yeah, and you're looking forward to coming over to the ICH to do your remaining modules as well, right?
Yeah,
Yeah.
very like I'm incredibly looking forward to term two. Yeah.
And what was your favorite part then of the modules that you've done with us at the ICH?
I think it's more like like the labs and the experiments, because for the cardiorespiratory one, the one about the VO2 max, the one that you were just talking about, we had a lab. We had an experiment using like the mask and stuff, right? And then it was just really fun. Like it's a nice an hour or two out of the week where you get to go and experiment. Well, I guess on your classmates or on yourself. Um, and you get to move, and also you get to move around because some of these stuff, like you have to like, for example, you have to like ride a bike or like run on a treadmill, and it's really fun. Even for the functional anatomy module, we had um a few experiments where, and it was very active and very fun to like get to know your body a bit more. Yeah. Okay, so there's a question. Oh, so let's see. Would I be able to get into the course with a sports science BTEC? I find this course interesting, but I am unsure if my qualifications can be accepted. Dr.
Sure,
Ger
I can answer that one. So yeah, so sports science BTEC. The short answer is it's possible, definitely. We have had students in the past join us and do a from completing a sports science BTEC. Uh, it's not the typical offer that we would go with, but increasingly so we have started to accept students on the who have done that pathway before. So if you do have any pre questions about that, it'd probably be best to speak to the Central UCL team who would be able to help you in terms of that. But online we have all of the grades in which we do accept, and sometimes we do accept students through clearing and also through access and widening reasons as well. So yes, it's definitely possible, um, but it's not the typical route in which students come to us with.
Thank you, Dr. Gurney. And the next question we have is, can you tell us more about the research project in year three and what we can do?
Sure, I can talk about that, definitely. So the exciting thing about your research project in year three is that you'll be completing your research project alongside staff members. So What we try to do at UCL is encourage our students to be at the forefront of research. And rather than creating your own, you'll usually be helping out some staff members who have already got some research projects up and running. But that's not to say that you can't do your own research project, which is really specific to your interests. But this project will last the whole of year three, whereby you'll be doing some form of research, whether that's lab based or online based or data based. The options will be given to you in your third year, and then you can go from there. And then write up your dissertation at the end as well. So it's a massive part of your year three, and also a really exciting one. And our students really enjoy that module.
Okay, thank you. And I think the next question might be for me. What inspired you to do Sims at UCL? Um, I mean, if the person was asking me, um, well, of course, I played a lot of sports in high school, and I got really into sports medicine, or like the scientific side behind what sports does to our body, or how we can optimize what we do and stuff in order to progress better in sports. Because I studied IB, and then like I wrote like an extended essay on something that's related to sports, and that's why I was like, yeah, I'm kind of, interested in SEMS. And like I went to a lot of different websites on UCAS and stuff, and then I found that UCL has this course, and I'm like, sure, why not just try to apply for it, and we'll see how it goes. And yeah, I just got into it, and it's a good choice. I say it's a pretty good choice to make. Yeah. And the next question we have is, could you please expand on the sports injuries section? How much of this course is centered around treating injuries versus injury prevention?
Yeah, so I can talk about that one. So you'll learn about injuries in year one and in year three. And so our specialist physiotherapist, Mr. Paul Fawley, leads those modules, whereby you'll be learning both about treating injuries but also injury prevention. So injury prevention you'll learn a bit in year two with Joe Warwick when he does his strength and conditioning module with you all. There's ample opportunity to go into those areas if that's your interest. But I will say that obviously it's not a physiotherapy degree, so there are aspects of the program which will be focused on treating injuries and injury prevention, but it really does take up, I guess, probably quite a small part in terms of the all of the modules that you'll do. Tinzian, I don't know if there's anything you wanted to add about what you've learned so far, maybe with Paul in year one, and maybe what's upcoming with Joe in year two.
For year one, we with Miss Dr. Paul, we mainly just focused on the functional anatomy parts, so like, like naming the bones and the muscles, and
Mhm.
like, for example, if you like abducted your like arm, like what muscles are being used, or like and stuff, right? And
Yeah.
I mean, it's good, especially like if some of you guys are into going to the gym, and you might want to know, oh, if I want to like strengthen my back, like what exercises I might have to do. And so it's like it's a really good like thing to learn if you're into that kind of stuff, and I think it's pretty fun, yeah.
Yeah, it's a really good foundation module, isn't it? Because when you do your third year, you'll be doing a massive module with Paul, which is all about treating injuries and injury prevention. Um, so yeah, it sort of builds the foundations as you go from year one to year three, in and around treating injuries and injury prevention. I hope that's answered your question.
Any more questions? These are you can for the people attending this, you can um ask questions anonymously, so like, yeah, have any questions, please ask. Yeah.
Jan, did you see the chat just from Kate there? So we can I think we can close early if we don't have any further questions.
Yeah, okay. So I think since we've answered all the questions, we might just leave it there. And um, if there is going to be a feedback form, an evaluation form after this session ends, and which will appear in your browser at the end of this event. So it would be greatly appreciated if you guys could fill out the form. And thank you all for your comments and questions, and thank you to Dr. Tom Gurney for an excellent session. Have a great evening, everyone.